Statins are among the most prescribed and most debated drugs on the planet. On one side, people say they save lives. On the other, that they're unnecessary and harmful. In this episode, we'll do what few do, calmly look at the actual trial data from both sides. But let me be clear from the start. This is educational, not medical advice. First, let's start with a strong consensus, because ignoring this side wouldn't be honest. Statins lower LDL cholesterol in the blood, more precisely, the ApoB-carrying particles. In a huge analysis pooling 27 randomized trials with 174,000 participants, each 1-unit drop in LDL was linked to about a 21% reduction in major vascular events. Heart attack, vascular events. Heart attack, stroke, vascular procedures. This effect was similar in women and men, and even in those at low 5-year risk, the proportional benefit was the same. And all-cause mortality fell too. There was no rise in cancer or non-cardiac deaths. So the claim that statins have no benefit conflicts with this data, but the skeptics have a fair point we shouldn't ignore. Relative benefit and absolute benefit are not the same. A 21% reduction sounds huge, but it's a percentage. If your risk is already low, a big percentage of a small number can be small. For a young, healthy person with very low 5-year heart risk, the absolute gain may be modest. By contrast, for someone who's had a heart attack or is high risk, that same percentage means far greater absolute protection. So the right question isn't are statins good or bad, it's what is my absolute risk and how much absolute benefit does this drug give me? The answer varies from person to person. The second fair topic, side effects, especially muscle pain. This has to be said avoiding two errors. On one hand, the complaint of people experiencing muscle pain is real, not made up. On the other, in blinded randomized trials, where no one knows who got the drug versus a sugar pill, muscle symptoms often occur at similar rates with statins and placebo. So the symptom is real, but its cause is often not the drug itself. This is called the nocebo effect. The practical takeaway matters. If you have muscle pain, don't just stop the drug. There are options like lowering the dose or switching statins, and most people find a solution. Manage it with your doctor. Now, let's keep the balance, because there's hype at both extremes. At one end, claims that statins are harmful for everyone, or that cholesterol plays no role in heart disease. Bed puntivix villen schapture knowing afterdy? The atrodings of comlictarctivicis heskes tanelmoin, for your reflays, these conflict with the large trial data. At the other end, the miracle pill approach that recommends statins to everyone, at any age, without ever discussing absolute risk. That ignores individualization. Healthy skepticism is good, but when skepticism turns into denial, that's an error too. The right place is the middle, and it's personal. So how do you decide in practice? 3 steps. 1. Know your absolute risk, your real risk, calculated from age, blood pressure, sugar, smoking, family history, and tests like ApoB or LPA. 2. Decide by sharing that with your doctor. The benefit is weighed against your absolute risk, your preferences, and any side effects. 3. Whatever the decision, the foundation from this series' early episodes, fitness, insulin sensitivity, fiber, sleep, is the base. A statin doesn't replace your lifestyle. At most, it's added on top. And again, don't start or stop a medication based on this video. To recap, that statins reduce heart attacks and strokes in appropriate patients is strongly supported by large trial data. But the benefit depends on your absolute risk. Side effects are real experiences but often occur as much as placebo in blinded trials and can be managed. The right answer is, neither everyone should take them nor no one should. The right answer is your risk and your decision with your doctor. This episode wasn't to pick a side, but to give you the power to ask better questions. This is not medical advice. In the next and final episode, we'll treat the modern toxins claims with the same balance. Measure, move, live longer. Subscribe.